Okay, so let's go quickly through the full blood count, which is also known as the complete blood count or hemogram. So this is simply an important and readily available investigation that focuses on red blood cells, okay, white blood cells and platelets and their various parameters. Okay, so it can help to serve as a screening test for many disorders and as a prognostic or follow-up too. So these are the components of the hemogram or the complete blood count. So here with white blood cells, okay, so they can either be increased or normal or less. Okay, so in some certain conditions, that's why you are going to see they have been increased or they are low. So we have to review in which conditions are they increased, in which conditions are they low. Red blood cell count as well. So red blood cell count when it's low, anemia. Hemoglobin as well, hematocrit, which is also known as PCV. This is mean corpuscular volume. Okay, this one talks about the size of the red blood cell. Is the size small? Is the size normal? Is the size higher than, bigger than the normal of the red blood cell? Okay, MCHC, mean corpuscular hemoglobin concentration. Of what concentration do we have of hemoglobin in the red blood cell? That's what we mentioned about. These are very important markers in terms of when you are coming out with the type of anemia that someone is suffering from. So you say if it's okay, I'll mention out when I reach the other side. But when you see that it's MCV, it's lower than normal, you say microcytic. Okay, if it's higher than the normal, you say macrocytic. Okay, meaning that the size of the red blood cells are bigger than the normal. RDW, this is red cell distribution width. Okay, platelets, neutrophils, lymphocytes, monocytes, basophils, immature granulocytes, as well as reticulocyte count. This is the normal values of the red blood cell, which is 4.7 to 6.1 in males, as well as in females 4.2 to 5.4. Okay, so a low red blood cell count is seen in anemia. Okay, so anemia, we had described it in terms of three categories: classification based on etiological classification. It can be as a result of blood loss. Okay, it can be as a result of impairment of the bone marrow. It can be as a result of hemolysis. So all these these are the conditions that we have. Okay, red blood cell destruction, nutrition deficiency, bone marrow disorders, where the bone marrow is failing to make the red blood cells. So in which conditions do we have a high red blood cell count? In polycythemia, it's also known as polycythemia, by the way, an increase in the red blood cells. So we can have it in dehydration, pulmonary diseases, okay, polycythemia vera. So hemoglobin, this is hemoglobin. It is the protein molecule that carries the um, oxygen in the red blood cell. So when you look at the red blood cell, there is hemoglobin. Oxygen is attached there, okay? Yeah. So in conditions where it's low, it is seen in anemia as well. This is hematocrit as well. Low hematocrit can also be seen in anemia. Okay. MCV, the one that I was saying here. This is a very for you to come up with whether it's microcytic, normocytic, as well as macrocytic. So this the normal is 77 to 95 femtoliter. So low MCV indicates red blood cells are smaller than normal, caused by iron deficiency, okay, or beta thalassemia, okay, lead poisoning as well. All these are part of the low MCV. High MCV, this means that the red blood cells are larger than the normal. Okay, so they are seen in megaloblastic anemia. Okay, vitamin B12 deficiency, folate deficiency will cause all this macrocytic anemia. Okay, atrophic gastritis, gastrointestinal malabsorption, all these, right? These are non-megaloblastic macrocytic anemias. MCH and MCHC. Okay. Mean corpuscular hemoglobin concentration measures the proportion of each cell taken up by the hemoglobin. Okay. So when you are looking at this one, you have to say whether it's a hypochromic, normochromic, okay? But of course, we don't talk about hyperchromic, right? Yeah. So MCH and MCHC, these are less in microcytic anemias. So we usually say microcytic hypochromic anemia, okay? But they're elevated in hereditary spherocytosis, okay, sickle cell disease, RDW, okay. Low value indicates uniformity in the size of the red blood cells. So the size of the red blood cells, when they vary, when they tend to vary, then high value indicates mixed proportion of small and large red blood cells. Okay, immature red blood cells tend to be larger. For example, in iron deficiency anemia, there is high variation and cytosis in red blood cells, okay, along with the variation in shape, which is the polycytosis, okay, causing an increase in the red cell distribution weight. Reticulocyte count, reticulocytes, these are immature red blood cells. Okay, when they are in increase, then you know that the bone marrow is trying to compensate for the red blood cell loss that is there. Okay, so this is that's about that I wanted to talk about. But we can quickly look at, let's say, leukopenia, which is the low white cell count. Okay, and in which one is, which conditions are seen in that? We also have leukocytosis, which is an increased white blood cell count. These are the values of the white blood cells, like neutrophils 50 to 70. So neutrophilia, it's an increase. Neutropenia, it's a decrease. Okay, eosinophilia, increase in the eosinophils, which is seen in parasitic infections. Okay, yeah, even in allergies. Basophils, we have got basophilia and basopenia as well. Lymphocytopenia means that they have been reduced, the lymphocytes. Monocytes as well, monocytosis. Okay, yeah, that's about that. Okay, all right, thank you.